Sleep disorders are really in its infancy. We haven't really had a great understanding of it. We didn't even know there was different stages of sleep until 1950.
Much of it still isn't understood. Most Americans don't want to believe their bed partners when they're told they snore loudly or they jerk while they sleep. Those signs are really what the sleep lab is looking for.
Cardiologists will be looking for patients, 1, that are obese, 2, that have significant nighttime snoring, 3, having daytime hypersomnolence, 4, having hypertension at a young age, and 5, having congestive heart failure and cardiac arrhythmias.
It's recommended you sleep 7 to 8 hours a night, but most people with sleep apnea problems don't get near that much. So doctors recommend they go see sleep professional Ed Devers.
And this is the part that everybody asks about. How am I supposed to sleep with all this? There will be 7 or 8 different wires on top of their head. So we monitor brain activity. We'll put a couple leads by their eyes, so I'll know if their eyes are open. We'll have a couple things underneath their nose and a snore mic on their chin or on their neck, so that we can keep track of airflow and whether they're breathing or not. There'll be a couple belts around their chest and tummy, so as we breathe, our chest and tummy should move in and out. So we'll know if they're trying to breathe. We'll put a red light on their finger, so we'll keep track of oxygen levels and their heart rate. We'll put a couple leads on their shoulders, so we'll know if their heart is beating correctly and regular. We'll put a couple underneath the chin, so we'll know how tight they are or what level of tension they're at. Lastly, we put a couple leads down on the person's legs, and we keep track of periodic limb movement syndrome, restless leg syndrome.
Patients stay at the sleep lab from 7:30 p.m. till 5:30 a.m. the next day. Doctors are then given the report that Ed completed, and doctors make a diagnosis from there.
Well, I tell you, it would be exciting if we had a magic pill for it. But really, the treatment for sleep apnea is diet, exercise, weight loss. Public Heart Hospital is pretty revolutionary in its thinking. And Sleep Lab makes perfect sense because it's a preventive measure. To look at sleep apnea, to treat sleep apnea, it reduces the risk for developing hypertension, coronary artery disease, cerebrovascular disease, heart failure.